Hello, good day. Thank you, Dr. Santiago Schwartz, for your kind introduction. And it's a privilege to be with all of you today. And, my topic today is aligning expectations with the global realities of today as part of the conference today of aligning global partnerships and community engagement with clinical research, the opportunities beyond the pandemic. I think it's a very timely topic because COVID has exposed many challenges before us, and there are many lessons to be learned. So first, I'd like to thank the PRCCI for their amazing 5-year, very successful journey to aggregate global thought leaders, especially in Latin American countries, to work together to be able to enhance clinical research that benefits our patients. The support and partnership with Northwell, the Center for Global Health, led by my friend and colleague, Michael Dowling, a true selfless visionary, has been instrumental in this journey. This is true scientific crowdsourcing. And I might add that one of the tangential benefits I see of this, especially for all the young people who may be watching and those that you mentor and are professors of and interact with, to be able to see so many people that are interested in Latin America and Puerto Rico, but many of the researchers themselves are Puerto Rican or of Caribbean ancestry. And so you serve as role models, whether you know it or not, to those kids who are not sure what their future looks like, and they see people that look like them, that they feel, maybe I can do that as well. So again, thank you all for that commitment. And I think it's much bigger than just solving the problem today, but really populating a population of young men and women to be our researchers and clinicians of the future. And again, to thank you once again for that opportunity to participate in this much needed conference, which is based in Puerto Rico, the island of my ancestors and my family. So the conference agenda is exceptionally robust and cutting edge. From macro to molecular, we'll discuss the issue of the issue of intellectual property, to virology, immunology, vaccinology, to precision medicine and prevention. But one of the things that we have to remember in these complex discussions is that the science is evolving so fast, it's quite complex, and that the people we have the privilege to serve really often don't understand. And why I bring that up is part of our problem is being able to translate this to an end user. That is understanding health literacy and cultural competence. That's not only speaking in the language, but also understanding the culture, but truly understanding how to translate the complex things we know in a simplified fashion, delivering them to an end user, the patients, the populations that we have the privilege to serve, really in order to do one thing only: to be able to engender sustainable behavioral change. So whether it is stopping smoking, whether it is any other health behaviors, or whether it is to be better prepared for the next pandemic, or what we would term all hazards preparedness, which includes pandemics, but also includes any man-made or naturally occurring challenges to a country or the world, as we're seeing today with this pandemic. It is very, very important that we stay focused on translating this complex information so that the average user can grasp it and then make better decisions that will benefit their families and their community, and hopefully lead them on a path of sustainable behavioral change that benefits all of us in aggregate. So let's never forget this important part of this journey in translating this complex stuff into usable, actionable info that our patients will act on. My topic today is very timely: COVID. And I tend to think of it as the great uniter, the great divider, and the great accelerator. Most of my life, I've been a first responder. And as probably many of you know that I've met, some of the best lessons that I've learned in life were ones growing up as a poor Latino kid in New York City, in Harlem, being the oldest of 4 kids of a Hispanic family, where my parents had English as a second language, and understanding what it's like to be poor, to be hungry, to go to bed with not a full stomach or with a toothache because you couldn't afford healthcare. And all of those things really helped me to be more sensitive to the challenges that we still face today. But there's no, you can go to graduate school and learn about this and understand how to describe social determinants of health and the academics, but there really is no substitute to walking in those shoes and really understanding what it's like for people to struggle day to day. So, waiting on the long lines in public hospitals to get care, being homeless at times and bouncing around with tios and tias, or living, with friends because we don't have the money to pay the rent. Never had a phone growing up. So all of those things I remember, and they help me to better understand the complexity of the society we work in today, and especially as it relates to COVID today, because one of the things that we know with COVID is that it exposed many of these inequities today, the social determinants of health that we speak of. And some of the first articles that you've seen written, I wrote with some of my colleagues, was we saw the exceptional mortality and morbidity in people of color because of COVID, because of those inequities that exist, because of the social determinants of health. And so COVID has exposed a number of those things. But it is therefore even more important that we understand the importance of health literacy and cultural competence, and being able to deliver all of this complex science in a usable fashion, translating it so that that end user can absorb it, use the information to make better decisions, and hopefully our goal is to effect sustainable behavioral change in that population. Now, if we don't do that, we may have the best science in the world, but that best science is going to fall on deaf ears and not be used appropriately to improve the health, safety, or security of the community that we're dealing with. So my topic today is very timely. COVID, the great uniter, divider, and accelerator. And again, most of my life I have been a first responder in a number of different jobs. So the issue of public health preparedness is really part of my culture. It's in my DNA now for most of my life. Having been a paramedic, a police officer, a soldier, a combat veteran, a registered nurse, eventually, a physician, a surgeon, a critical care doctor, a researcher, and ultimately a distinguished professor and becoming Surgeon General of the United States, and even being a CEO of a public hospital and a healthcare system. So all of those things have greatly informed me as to the complexity of the challenges that we all work in and the privileges we have, but also the importance of research, which is what you all are all about with the PRCCI and the partnership with Northwell that is allowing all of us to come together and aggregate this data to really benefit, especially communities of color and those communities who are disadvantaged and more express those social determinants of health. But also it's beneficial to the rest of the world. And what COVID has done is to expose many of these vulnerabilities, because as you all know, as COVID hit, what we saw were certain populations that were significantly disadvantaged. These are people who are suffering on a daily basis. You look at the population in Puerto Rico today, after a hurricane that nearly destroyed the island, and now to be hit with COVID and to be struggling with the same problems that they've had before. The industries are decimated, there are no jobs, and people are struggling. And these are the people that are more vulnerable to these problems because they don't get healthcare in a timely fashion. They have more chronic diseases. So it's important that we understand that connection and how COVID has further exposed that. Several papers were published, one from my colleagues and I back when COVID started, when we saw the disproportionate mortality and morbidity in people of color in the United States, including Puerto Rico. So the topic today is very timely as far as COVID, and COVID has been devastating globally, but it has exposed these societal vulnerabilities, the health inequities, the social determinants of health, in a Darwinian manner. It has taken over 725,000 American lives, to include over 3,200 in Puerto Rico. But COVID has also demonstrated the strengths of the US and the world through selfless scientific crowdsourcing of scientific information to solve the ongoing threats from an invisible microbe that both strengthened and weakened us simultaneously. We now have the opportunity to take these memorialized lessons forward to make a better future, because we must learn from this experience of the last almost 2 years now, coming up on 2 years in the winter. And that these lessons must be memorialized. They must be taught to those behind us so we don't forget. And I'll direct you, for those of you who haven't read the book, John Barry published a book on the Great Pandemic, the so-called Spanish flu of 1918. And I might mention that was a misnomer. It had nothing to do with Spain or Spaniards. Unfortunately, the Spanish king got the disease and he got blamed for it. And again, exposing some of the biases and prejudices at the time. But really, this was a global pandemic happening coincidentally during the First World War. And so the book is interesting because if you look at the history that's so well archived in this book and you change the dates, it's relevant to today. They were having battles over masks, battles over mitigation strategies, battles over the economy, battles over individualism in a democracy and not being amenable to being told what to do. And so what I find is amazing, 102 years ago, the same thing happened and we repeat the same mistakes today. So it's important that we learn from history because history is the prologue to our future. And as Surgeon General of the United States, I dealt with a lot of national and global emergencies like Katrina. And we built an infrastructure to be able to handle what we call all hazards today. A pandemic is one of many hazards that can affect the health, safety, or security of the nation. And so to do that, there must be an infrastructure. The infrastructure is the same, whether it's an earthquake, a tsunami, whether it's a pandemic, whether it's a terrorist event, whether it's an active shooter. It really doesn't make any difference because it's the same first responders and networks that come together to be able to prevent, respond, mitigate, and recover from any and all hazards. And that's what we did with this pandemic. Unfortunately, when we look at the timeline, we got off to a bad start. The very organizational structures and infrastructure that we had in place from several years ago, especially after Katrina, to be able to stay ahead of evolving infections, where we had a special team that was part of the National Security Council that actually their job was to monitor the world for situational awareness and make sure that there was nothing coming our way that would surprise us. Unfortunately, political decisions were made to disband that group. And because of that, we were not situationally aware as we should have been. There was a delay. In addition, at our CDC, in the past, we had what were called push packages. And these are, and they weren't there, but they're distributed around the country actually in strategic locations to move quickly when any community is challenged with a all hazards threat, like a pandemic, and their resources are not enough to address that threat. The federal government has these stockpiles, a strategic national stockpile that they can send beds and ventilators and food and water and drugs at a very short notice to communities when needed as part of the national response framework. So all of this was embedded, but unfortunately at CDC, funding was not as robust as it should have been. The strategic national stockpile was not as ready as it should have been. When we look for masks, there weren't enough masks there. When we look for certain other entities, some of these things were not rotated out as they should have been, and we weren't prepared to respond very quickly. So right from the beginning of COVID, our level of preparedness was not what it should have been. And unfortunately, much of that was due to poor political decisions that didn't allow us to be optimally prepared at that time. Nevertheless, we moved forward and we responded. So when I look at the continuum of how we deal with all hazards, from again, trying to prevent anything, but to prevent it, you have to have situational awareness that you know what's coming your way. responding to whatever that threat is. And responding to means you have the resources to be able to handle it locally, or you bring in through mutual aid other communities, or you kick it up to a national level through a governor who then can address the Stafford Act, and the president can release funds and so on. So there's a hierarchy that's done. The hierarchy was done, but it didn't work as efficiently, as effectively as it should. And then, of course, we ran into the issue of what I call the perils of democracy, the right of the individual versus the collective right of society. So this is something I dealt with routinely as Surgeon General. Something as simple as smoking. And people would tell you, you can't tell me not to smoke. I'm an American. I can do that. But you're right. You can smoke, but your smoke is hurting and killing other people. And so how are their rights being expressed? And are you willing to pay for the cancer or pulmonary disease that you will ultimately get? So your right has an impact on the rest of society. So when I look at everything from stem cells, abortion, smoking, that's why I call it the perils of democracy, because every one of these issues, people have an opinion about themselves. And in COVID, well, I'm not going to wear a mask. I don't believe in vaccines. Conspiracy theory came up. And at a time when we were being challenged by an invisible threat, in effect, we were at war with an invisible threat, we should have come together, as in any war, not as Republicans or Democrats, but as Americans, to take the best science the world knows and the best people to solve a problem as efficiently and expeditiously as possible. We didn't do that. We allowed this threat, this invisible warrior, to divide our nation. And so as I looked across the country, and in my position, both as a distinguished professor, but as the incident commander for COVID for the university, and more recently for the whole state, I saw painfully how we became a disunited states, where each state was doing what it wanted to. And sometimes within states, cities would be arguing with their governors, and we became divided. And the conspiracy theories flowed, and bad information went out on social media, where people would say to me, you know, this is really government just supporting the pharmaceutical industry, or they're injecting chips into us because they want to track us. And of course, I would always just hold up my iPhone and say, look, they don't need to inject a chip. They're following you all the time. If you've got a phone, they know where you are and they know what your purchasing patterns are. But nevertheless, it's hard to defeat these conspiracy theories with rational discussion or scientific methodology. People get well entrenched. They align with their political parties. And I often joke with some of my colleagues at NIH and CDC early on that really the one vaccine we needed, I know that we're going to come out, this was a year and a half ago. I know we're going to get a vaccine pretty quickly because of all the great work that's done and the crowdsourcing of scientific information globally and so on. But the one vaccine we need, we're not going to be able to get. And I said, that's a vaccine against hyperpartisan politics, because I think it's as virulent as the virus itself, maybe more so. And it kept us divided. And that division today continues to make this virus even more virulent, because as you know, the longer we don't have herd immunity, a large part of the population vaccinated, the problem is that that virus continues to mutate. And at some point you get a variant that potentially can make our vaccine not effective. And in which case you have to start the process again. And so we're not only talking about the United States now, because the job for us in an all hazards market with a national response framework is to protect the nation against all things that can cause health, safety, or security breaches to our nation. But we are merely 330 or so million people in a world that's approaching 8 billion. And if we don't get the whole world vaccinated, even if we try and capture herd immunity in our United States, that virus will still keep circulating all over. And as long as it circulates, the whole world is vulnerable because, as I said, the mutations and variants that we would expect over time, because that virus is trying to compete to live in our world, just as we are trying to stay alive in our world. You know, Darwin's theory of evolution and survival of the fittest applies to unicellular organisms or multicellular organisms like we. So it's important that we understand that this is truly a global threat. Yes, we have to take care of our own, but we should be doing everything with other developed nations to vaccinate the world, because that's the best chance for us to hold this in check and return to whatever our new normal is going to be. And we learned that through polio. For those of us who are old enough to remember that those years in the 50s and 60s where moms were afraid to send their children to school because we saw the pictures of children in iron lungs and being paralyzed. And Dr. Sabin and Salk came up with a vaccine, and people united as one, not as parties on the left or right, but as one. And everybody got their vaccine. And what we see today, that polio is largely extinguished in the world because of vaccination. And vaccines, arguably, are the best scientific advance in the history of mankind. You think about polio as an example, measles, mumps, rubella, whooping cough, tetanus. Those are all vaccinatable diseases. And because we vaccinate, we don't see them or rarely see them. And when we do see them, there are breakthrough infections because we have people who are not vaccinated. So it's really an enigma in that the very people today who are the deniers and vaccine hesitant, as it's been come to say, are the people that have their kids vaccinated when they start school. Why? Because they don't want the kids to get any of those vaccinatable diseases. And we don't want them to spread to other populations because of the morbidity and mortality. But yet we have a large population expressing their individualism in a democracy, which is legitimate, but nevertheless misinformed. And so that vaccine hesitancy is creating a very significant challenge for us and the rest of the world, because we can't achieve that herd immunity as quickly as we'd like to. So with that in mind, I look at COVID itself, and I look at it as the great divider, uniter, and accelerator. And as the great divider, as I've just expressed, it was heartbreaking for me as a Surgeon General and a professor to be able to see communities divided around this when we needed to be united. It really brought out, in some cases, the worst of us and the best of humanity at the same time. And in doing so, it slowed down our ability to get control of this. And today, as I said, we still remain somewhat a disunited states because of the political challenges where certain individuals use this as a tool to undermine a competitor in the political sphere. And that should never happen. So we've seen how an invisible threat, this microbe, has served to divide our nation and take advantage of the inherent weaknesses of democracy, of the individual right against the collective right of society. But yet we've also seen how the world came together in a very positive fashion, crowdsourcing information, much like the group in this conference that come from all over the Caribbean and around the world, thought leaders in every discipline, immunology, vaccinology, intellectual property issues, and share that information selflessly because it will make us all better. And so I see a lot of good things that have happened in generating the mRNA vaccines, generating the fastest time in history vaccines, being able to manipulate those pretty quickly if we have to with variants that arise. Unfortunately, not yet. But the acceleration has been extraordinary as it relates to our response to this virus. So we've been divided. We've been united around this virus. And one of the most amazing things I saw early on, and speaking with my colleagues at NIH and CDC, speaking at my academic colleagues, where they were 24 hours a day exchanging text, emails, phone calls with colleagues around the world, and selflessly sharing information not worried about the proprietary side, not worried about getting promoted, not worried about the business side of the intellectual property they were developing, but really having a common purpose, a value proposition to save the world, and share that information, which allowed us to significantly accelerate the first vaccines and getting our country vaccinated. Of course, we're still lagging. You know, if we look across the country, maybe we're approaching 60% or so in the amount of folks that are vaccinated. I might mention that, you know, Puerto Rico's done a fairly good job, remarkably, with the paucity of resources, with the challenges they've had, with the unemployment, with the loss of the tourism industry, with the loss of the pharmaceutical industry. And yet, when you look at the numbers, about 76%, about 3 out of 4 people in Puerto Rico have received 1 dose. About 68, almost 70% now are fully vaccinated, and almost 100% of the seniors, 65 and older, are vaccinated. Those are really, really enviable numbers that are better than many states in our United States today. So, you know, they've done a good job. And even though they started out with possibly the least amount of resources and some of the greatest health disparities that are up here in our hemisphere. So the united part of this is manifested too in all of you that are sitting here today in this discussion group and sharing the information so we can move to the next generation. Because this is about aligning global partnerships and community engagement with clinical research and opportunities beyond the pandemic. Meaning, what have we learned from this pandemic? Where are we going to take this? How are we going to make it better as we move forward? How do we prevent these missteps from happening in the future? How do we memorialize this information? And once memorialized, how do we train those young men and women coming behind us to be the scientists, the clinicians, the first responders of the future that understand how to handle these very complex issues based on the mistakes? You know, Katrina is almost 20 years ago. And yet when I talk to some of the young folks who are even in public health or in health sciences, very few of them have an understanding of how you surge for a challenge like this and what resources are available and how you bring them together, both scientifically and clinically, to be able to protect a community or the nation from a threat that involves the health, safety, or security. And then you expand that out to the world where we have to share information and be able to work together. Besides the US protecting itself, it's often the first responder for the world, especially third world countries. Our military goes, USAID, Peace Corps. We have all these organizations and some of the non-governmental organizations that do this to save the world, like in Haiti right now, and in other places that don't have an infrastructure to be able to protect their own people. So how are we going to learn from this? How are we going to tell the story and memorialize the pathway of what hurt us, the divisiveness, the story of how we were united and accelerated research tremendously fast, and the story of that acceleration and how people came together selflessly in order to save their communities, the nation, and the world. Really, that's the benefit of you all being in the room today, and that I see such a positive experience. When I look at the names, when I look at the topics from the macro to the micro, as I said, this is an extraordinary organization that's only been at it for about 5 years with the PRCCI. As I said, Michael Dowling, my friend and colleague up at Northwell, is committed to using his resources at the Northwell Health System, one of the largest in the country, to assist. And we see that manifest here today. So as you listen to all these lectures today, I hope that not only is a sense of urgency imparted to you, but also that you have a sense of responsibility, a sense of commitment, not only to the basic science research that is essential for us moving forward, but parallel to that, the infrastructure that gets to use that information to get to the communities. How do we build that competency into our public health programs, into our emergency management programs? How do we get every responder to understand that we are inextricably tied together as a nation, as a world, that cases starting someplace else in the world ultimately are our problem as well, whether it's HIV or the next pandemic that could occur. So I am spending a lot of my time now thinking through how to memorialize, how to make sure that these lessons aren't repeated in the future because we forget what the importance of the work that has been done. I think that it is a very significant responsibility of us now in this critical juncture in our society where we are still struggling through the politics of the day, the divisiveness, that two parties can't agree on even whether the sun is out one day or if it's raining. And yet we desperately need leadership now. Leadership that is selfless, leadership that comes together for the greater good of the nation and the world, leadership that funds and supports the research that you all are doing, that the PRCCI is doing to bring together some of the most disadvantaged countries out here, that are some of whom are represented today. And let's not forget that this science, this research, this ability for us to come together, share information is not only about preserving our society and humanity, it also is about building economies. Puerto Rico desperately needs, for instance, jobs. It used to have a booming pharmaceutical industry. It doesn't anymore. But with the ideas that are here with the PRCCI, with the ability to do more research and train lots of young men and women to be the researchers and clinicians of the future, to be able to create new industries around research and around clinical practice to benefit the people, there's an economic benefit as well to moving forward on these agendas. So as I close, I will ask you, as you think through things, think about COVID as the uniter, divider, and accelerator. Think about the experiences you have and how they can be translated. Think about how we can support all of you who are researchers in the audience to be able, through genomics, genetics, microbiology, immunology, virology, how do we capture all of that information? How do we develop seamless systems where this information can flow and be shared by everybody quickly? Very important. Remembering that as we look to the future and we're trying to optimize health and wellness, because let's face it, we all want to live longer, younger, happier, healthier, and cheaper. And we have to look at what those variables are on a daily basis. You know, we know that what you eat, how you recreate, your relationships with other people. Then there's the built environment that we largely ignore, but COVID has exposed how vulnerable we are because of the antiquated way that our buildings are built, from everything from our air exchange and HEPA filters to ingress and egress. And then we start to understand that all of these variables are actually epigenetic inputs. And your body's surveillance system are your genes, and they watch what you see and they act appropriately. So if you want to optimize health and wellness, including national security and dealing with pandemics and epidemics and any kind of emerging threats, we have to recognize that everything we change in the environment ultimately becomes an epigenetic input. And what that does is it changes gene expression, positive or negative, if we address it. So it's important that we think of this from the macro to the micro. And I see on the agenda today, we have all of that, including precision medicine and precision prevention. I think that Dr. Ramos is speaking about that, who used to be at the U of A, and so happy he's involved in this as well, because he's a great thinker. But these are the kind of things we have to be thinking about to create our future. It's not just about solving today COVID and gasping and taking a breath and going, okay, I'm done. No, you're not done. How do we take all of this information now capture it, memorialize it, teach it, mentor it to those behind us, and make sure that the community we are living in, the nation we have the privilege to be in, the world that we are a part of, where we're a great influencer, shares that, so that we can all be healthier, safer, and more secure in the future. There are lessons to be learned, and we can't forget those just because we're focusing on surviving today. We must be memorializing, teaching, educating, and researching. And for all of you in the audience, thank you for all the research that you do, especially those basic scientists and clinical scientists, because it's you who are getting us out of this mess today. And because of that, we need to figure out ways to get more funding. We need to figure out more ways to inspire young men and women, especially young men and women of color, to go into these fields, because they have a different understanding of culture and how they can contribute, because they have a better understanding in growing up in those cultures. Just like I did. Some of my best education was because I grew up that way, in the hood, so to speak, poor. But yet I never forget those experiences, and they contribute to my passion to be able to try and pay it back and help all of those who don't understand those things. It does take a team, it takes a village, and you all are the village that we need to solve these problems. So thank you very much for the opportunity to be with you today. Please continue your work, not only to solve today's problem, but let's answer those bigger questions of how do we sustain this? How do we build this into our infrastructure? So in the future, we have less and less challenges to the health, safety, and security of our nation and the world. Thanks very much.
We thank Dr. Richard Carmona and all of our speakers for their time and the valuable information they have shared. And now, to conclude this 2021 PRCCI Summit, I would like to invite Dr. Amarili Silva Boschetti for the closing remarks.